COVID-19 has affected college students' mental health. Here's how a college has responded.
Before COVID, students had mental health challenges because, a lot of folks do with anxiety, whether it's test anxiety or other types of anxiety. They also had depression issues. So we encountered it a lot, but we didn't have it maybe as frequently or as large of a volume as we have now, since COVID has taken its toll on the entire country for the last 2 years. In students, we are seeing more anxiety at this time and depression, most often because they were isolated and didn't have a lot of human contact other than their family members, which, depending on your family, can be very challenging to be in the house with the same people every day, all day, and not go anywhere. But we do see a lot more anxiety. They were anxious because they were isolated, and then now that they're back in person, now they're anxious because there are people around, and oftentimes they're no longer comfortable being in large groups, or there's a lot of social anxiety because they don't remember what it's like to interact with people and have friends. To address this situation, ASU has enhanced their counseling services. We've always had counselors available for students at a low cost to them, but when COVID hit, we made counseling free, and we expanded it to 24 hours a day, 7 days a week. So students can see a telecounselor, meaning they can Zoom with somebody, they can talk to somebody on a phone, any time of day. Doesn't matter, any day of the week, doesn't matter if it's a holiday, if it's a weekend or whatever. They can get that assistance when they need it and where they need it. They can still make appointments to go in to see the counselors in person, but sometimes they're backed up for several weeks. So there's always somebody ready to talk to our students to help them through a crisis or just I'm having a really crappy day and I just need to talk to somebody.
Help can be found on ASU's website and their search bar.